how can one choose whether a person requires a surgical aortic wall replacement or a transcatheter aortic wall replacement? People with aortic stenosis who are less than 65 years of age, because their longevity is more than 10-15 years, so that group of patients are preferably treated by a open heart surgery and a surgical aortic wall replacement using a mechanical aortic valve or a metallic aortic valve. Whereas people who are more than 80 years of age, these are high risk patients for surgery, so the therapeutic option is only replacement of the aortic wall using a transcatheter technology or replacing of the valve using a transcatheter valve. Whereas people between 65 to 80 years of age, the heart team, which comprises of the cardiologist, cardiac surgeon, possibly radiologist, echocardiographer, patient's family, all of them together sit together and decide for that particular patient which is the best option. And also the patient preference also will take into account, because it is a combined decision making for deciding by the heart team whether we need to replace the valve using surgery or by the transcatheter method. Lot of patients ask me whether aortic stenosis can be treated by medicines. There have been lot of research which has been conducted using various medicines to retard or halt the progression of severity of aortic stenosis. Most of these trials were negative, and till date there is no medicine which can stop the progression of aortic stenosis. Having said that, it is important to prevent the progression of aortic stenosis or the rapidity of the progression of aortic stenosis. That is by effective control of hypertension or high blood pressure, a good control of blood glucose, control of the blood lipid levels, and also if there is any associated heart vessel blocks, an early treatment of the heart vessel blocks is required for treating these patients with aortic stenosis.